All right, I'm going to show you how to do a massage of the calf muscle, the Achilles tendon, and the plantar fascia of the foot while the patient is laying on their stomach. So first of all, you want to start and get some lotion in your hand and then onto the patient's skin. So I like to put it on the whole area to start with. Okay, then you're going to come back and you're going to start at the calf. You can do just some gentle strokes like this with your hand, one hand. You can do both hands depending on the largeness of the patient's leg, or if it's a baby, you may just want to use just your fingers. Okay, so you can start by coming up very gently and out. You can do little circles around the muscle here, or you can just do massages like this. Okay, by bringing your fingers up, you can feel if there's any scar tissue in the muscle. You can also feel of one side versus the other to see if there's any difference. So after you've done the calf muscle, then you can come down to the Achilles. Now the Achilles is a little strip of tendon that comes and attaches on the calcaneus, or the heel bone here. So the best way really to massage the Achilles, and it does start way back up here as a broad tendon and kind of comes down to a narrow tendon as it attaches at the calcaneus. So one thing you can do is just take that Achilles and just move it back and forth. I want to get a little closer there so we can see. Just move it back and forth here. Okay, you can start up high, kind of work your way down low. You'll notice as I move the Achilles, her foot also moves. So if you're not seeing that, that may mean that there's some restriction in the Achilles. All right, now we're going to move down to the plantar fascia that starts at the end of the calcaneus. It's a spider web kind of looking thing that goes, it starts here and it branches out and it goes up into this big toe area there. So as I push, come in close, Sadie. As I push, you can kind of see there's some tightness kind of in here, but there's not a band that pops up. If someone has a really tight Achilles, there'll be a band of tendon that'll pop up right there and you can see it. And again, you can compare one side to the other side just to kind of see if there's any difference. Okay, so what you want to do is you want to put your hand kind of up at the top here just to stabilize the leg. Okay, and then you want to come down, start at the calcaneus, and just bring your finger down. And because it does kind of start here and fans out, then you want to go down to the great toe. You want to go down to maybe the second toe, top to third toe, top to fourth toe, and the top to the fifth toe. Another thing here you'll notice is as I go to the fifth toe, how the fifth toe kind of splays out to the side there. Does that feel okay, Em? Mm-hmm. Okay. And another thing you can do is bring, depending on the size of the patient's foot, is you can start and you can kind of bring down like this, okay? If the patient's foot is big enough for both hands. Once you get that limbered up, you can do some stretching of the calf here. So put your hand underneath and you can kind of bring your hand across this whole foot and stretch down to stretch out. You want to also come out to the side a little, just to stretch. Is that okay, Em?
Yeah.
Okay. All right. Then you want to make sure you get a good stretch of the toes, and especially this big toe here. So as you come down and stretch, again, your hands underneath, and then you can just kind of give a little stretch to that big toe. Okay, you can stretch the little toes individually if you want to. And then you can stretch them all together with your whole hand, either across this way or across this way, depending on the size of the baby's toe or the patient's toes. Good. Okay, so that is how you do it on their belly. And then so let me just show you the position you would use for the side. So Em, flip onto this, to your left side. I'm sorry, this side up. There we go. Okay. So basically, on your side, babe. On your side.
Here?
Mm-hmm, yeah. So on the side, you might have to have a pillow kind of underneath. But again, you can get to the calf here, do your massage there. You can get to the Achilles there and do massage there. And then to the plantar fascia, again, with them on their side. Like I said, throw me that pillow, Em. You can put a pillow between their legs just to kind of keep them in a better position, or bend this bottom leg back. Okay, So that's a way if you have a patient or the baby can't get onto their belly. All right, and then on their back, go ahead and lay on your back, Em. Come up over top, Sadie. Same thing here, but you can't really see what you're doing, but you can feel what you're doing. So you're gonna massage the calf here, okay? Kind of get underneath and massage there. Bring it down and massage under the Achilles. Again, you can't see what I'm doing, and you're not gonna be able to see what you're not gonna be able to see. But once you've kind of done the massage on your back for a little, on the patients while they're laying on their stomach for a little while, then you may be able to kind of feel what you're feeling. The plantar fascia, again, as we come down, you can kind of up this way. Okay, go to each individual toe and out to the side. And then again, don't forget the toes, so you can stretch them all together as one. Can you come over top so they can see? You can stretch them all together as one. Or you can stretch each individual. So don't forget that big toe. Okay. And again, we were talking about earlier the deep pressure. So if I go like this, are you not ticklish? If I go like this, the patient is gonna like pull their foot up. They're gonna try to get away from you. So one thing you can do is just, make sure you have that firm pressure. Keep that firm pressure. Even on the top, you don't want your hands up here kind of doing little silly tickly things either. So keep some firm pressure. And start by firm pressure to start with. So don't let your hands just kind of graze over the top, because that's going to be tickly. So firm pressure, slow, gentle motion. Use some lotion or something to kind of put on the skin to decrease friction so it's more comfortable. Again, start at the calf, work your way to the Achilles, then to the plantar fascia, and then onto the toes. Okay? All right, if you have any questions, text me or call me. Have a great day.